Anyway, it says here, the reason we should look at Dangui is because Dangui tonifies the blood. It treats deficient blood energy, and deficient blood energy in Chinese medicine is what Western medicine calls menopause. Yeah, menstrual flow abnormalities, nervousness, dizziness, insomnia, and forgetfulness. So here you have also, both in the Western research literature and in the Chinese medical tradition, two different ways of thinking about the menopause. This claim, in the as anybody who does Chinese medicine, they know the blood is very important for treating women. Yes, okay, and in Chinese medicine, the blood is very much linked to the stomach, where it comes from, and also to the liver. And I just give you this as one particular example, that there is obviously, for this modern claim that menopause might have something to do with the blood, there are ample historical texts to which you might want to attach such knowledge. And again, we have done a study, we also have published in a biomedical journal, we've done a comparative study of the use of, we looked at the usage of, or the treatment of menopausal symptoms by what we would call not Chinese, East Asian medicine, but it's all based on Chinese medical formula. So we looked at use in mainland China, Taiwan, Korea, Japan. It's very interesting. In mainland China, as we saw before, the dominant thing is treating it through the kidneys. Interesting, in Taiwan, Japan, and Korea, the most commonly prescribed formula is a formula called Jiawei Xiaoyaosan, okay, which is not a kidney formula, but it's very much a liver blood formula, isn't it? Yes, okay. And actually, in Japanese, it's called Chinomichi, women's problems, the way of the blood. Yeah, okay. So it's very interesting that we have these two main ways of thinking about menopause actually being practiced, but however this practice is very different between Taiwan, Japan, and Korea, where basically the knowledge is of the kind of dominant prescribing is different. Where in China and globalized TCM here in the West, where it's involved. So again, why is it different here? We could say here there's a certain fetishization in the translation of biomedical knowledge. Because what happened here, why did the kidneys become so important? Because estrogen deficiency is accepted as a reality. So even though it's Chinese medicine, Western medicine is a fetish. Yeah. Of course, another explanation could be for these differences is what the anthropologist Margaret Locke calls local biologies. What does she mean by local biologies? This is even though I'm an anthropologist, we sometimes do some quantitative research. This is a survey we did of about 1,000 and something menopausal women here in London, and we looked at their symptoms. Yeah, and it's very well known actually. This is nothing new. Again, we just replicated stuff that other people have done a long time before us. It's actually very clear that women's experience of menopause differs. Yes, differs in different places. So here we have London, Beijing, Massachusetts, Manitoba, and Japan. The amount of hot flushes that women get, what are their main symptoms, you see, it changes, and the incidence of symptoms changes a lot. Yeah, okay. It's very difficult to explain why. It cannot just have to do with diet. It cannot just have to do with genetics. For instance, our symptoms. If you look at the symptoms here, the women in Beijing and London are the most close to each other. Yeah, okay, which is very interesting because it cannot be genetic and it cannot be diet. Yeah, okay. It might however have something to do with time, because these are the two most recent studies, whereas other of those studies are 20, 30, 40 years old by now. Yeah, okay. But anyways, this is what Margaret Locke says. The experience of illness is not just our bodies as a biological thing, but also the bodies in the sense of them existing at a certain place, at a certain time, interacting with cultures. And obviously for certain illnesses, this local, the effect of the local on the biology will be more strong, and on others it will be less strong. Yes. But this could perhaps explain why women in, or it would be at least one idea why women in, one reason why women in Beijing might be treated or have a different Chinese medical diagnosis than women in Tokyo. Yeah, okay. But actually, it's also very interesting for me as a researcher. Obviously, the diagnosis or the Chinese medical standard of women, menopausal women being kidney deficient in Chinese medicine is being exported through the world as a kind of like an universal way of looking at menopause through the eyes of Chinese medicine. And historically, at the same time that Chinese medicine comes up with the universal way of viewing menopause through the eyes of Chinese medicine, Western anthropologists go through Asia and deconstruct the universalist view of menopause as a problem only of biology, and showing that it's actually very, very varied. It's quite interesting how this happens. Yes? And that would play into the hands of my assumption of the construction of the kidney deficiency model in Chinese medicine as a fetishization of biomedicine. Yeah? Okay. Sorry. So this is another study that has just been published in 2010, again in Maturitas. And this is a long-term survey in various Asian countries about how Asian women experience the menopause. So what does it say? Actually, they do have symptoms, but they don't necessarily treat them. Or if they treat them with herbal medicine. And obviously this is experienced as a great deficiency, yeah? Because why don't they use drugs? Yeah, okay. But also interestingly here, once they take the drugs, we also need to inform them about the side effects of the drugs that we have told them to treat a condition that they themselves didn't want to treat, yes? Or which they apparently are quite happy to treat with herbal medicine. Obviously the real context might be much more complicated. Maybe it's that women are not allowed to express their symptoms, yes, okay, that they are that the suffering is the suffering or the way you experience your body is of course also tied to a particular local and cultural context. What you're allowed to express and perceive as an illness may not be the same in Japan as it is in the UK. Yeah, okay. But anyway, and therefore, one of the last slides I want to show you here as well. This is again from a systematic review of the effect of herbs for treating menopausal symptoms. This is from ginseng. They did, one of the RCTs they did on ginseng, and they treated for menopausal symptoms. And it says it's significantly superior to placebo in reducing depression and helping well-being, but it doesn't work for vasomotor symptoms. So therefore, it doesn't have any effect. Yes? So obviously the women feel much better, but because it doesn't change certain things, it's not effective. But what things doesn't it change? It doesn't change the things that are natural. So also here, what is a fetish? Yes? Obviously here, in what supposed not to change is women are supposed not to get older. Can you see that? Because endometrial thickness, estrogen levels, etc., the decline, the decline in the endometrium, in the thickness of the endometrium, the change in hormonal levels, that is what happens when women get older. If a change in those levels is considered to be the fact that, can you follow my reasoning? Yes. If it's supposed, if the only effective treatment for menopausal symptoms is to reduce the woman to the state that she had before she entered menopause, then there is a certain ideology here also about what it is about a woman that is healthy, that is not healthy. Is it okay for a woman to have thin endometrium? Obviously not.